You're listening to the Quint's podcast.
When it comes to COVID-19 in India, all eyes for the past week have been on Kerala, which has added more than 10,000 cases every day since 28th July. Its positivity rate is more than 6 times that of the national average. While the rest of the country is experiencing a sharp decline in cases after reaching a peak in April-May, Kerala since 15 June has been reporting a steady climb of 10,000 cases a day on average. Now, the recent spike in cases are making headlines. Between 27 July and 1st August, the state reported more than 20,000 daily COVID cases, bringing the total caseload to 1.65 lakh. So, how has a state which was hailed for beating the medical oxygen crisis incurred by other states in April-May and for its handling of the pandemic, still reporting so many cases? What went wrong? Or are these the first signs of the beginning of the third wave in India? To understand the ground reality in Kerala, for this episode, we spoke to Dr. Sulfi Nuhu, Secretary of the Kerala chapter of the Indian Medical Association, and senior Kerala-based journalist KP Setunath. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. Kerala has been in partial lockdown for the past 85 days, for which the Pinarayi Vijay-led government has been facing harsh criticism since the economy has taken a big hit owing to the lockdown. For example, according to the lockdown rules, non-essential shops which fall into areas that have more than 10% positivity rate, which at present 6 out of 14 districts do, can only open on 3 days a week. As a result of the lockdown restrictions, the state's powerful trade union, the Kerala Vyapari Vyavasaya Kopana Samiti, has even said that they will be going against lockdown restrictions and opening shops from 9th August. However, despite the anger towards the state government, according to senior journalist KP Setunath, there is a sense of uncertainty and fear in the air given the rise in cases.
There is definitely a sense of worry in the sense that the infection rate is remaining at a kind of a constant level, and although the experts are saying that we don't have to be unduly worried about it because the tapering of kind of an effect is going to be a slower process in the state, and we should not be overtly much worried about the situation. For instance, if you look at the yesterday's data, that is Monday's data, the number of infected patients was something like 13,000. So, but the number of people who are who have been tested was also low compared because in the Sundays the number of people getting tested are low. So today we have to look at the today's picture. And secondly, and today the state government is also bringing out, because there was a committee headed by the state chief secretary looking at the lockdown measures and what kind of relaxation should be given for the lockdown. And today the government, the state cabinet is meeting today evening, and indications are that they are likely to relax some of the restrictions. For instance, nowadays they are allowing only the grocery shops and other things to be shops and things like that to be functional throughout the week. But today there are indications that the government may relax and allow all kinds of shops to open till 5 days in a week, and some kind of, so those kind of relaxations are all and are likely to be implemented from today. And another thinking is that they are trying to restrict the lockdown into a kind of a micro level lockdown, so where there's a number of infections, and the most vulnerable areas will be locked down or cut off from the rest of the place, and things like that. But Kerala is being a very the population then in a very highly densely populated region, and the movement of the people from one place to another place is quite frequent compared with other states in the country. We don't know how this idea of a micro level lockdown is going to really work out, and and that is the situation right now.
According to COVID-19India.org, which curates state and central bulletins for COVID-19 data, on 4th May, Kerala reported 17.01 lakh cases. A strict lockdown has been since implemented to curb the virus. However, the caseload has doubled to 34.25 lakh cases as of 2nd August. If the lockdown restrictions are so strict, why is the state reporting so many cases? A part of the explanation for Kerala's high caseload can be due to its excellent COVID surveillance. According to the latest National Seroprevalence Survey conducted by the ICMR, only 5 infections go unreported for every reported case in the state, as compared to the national average of 25 unreported cases for every case reported. Kerala has also topped the charts when it comes to testing per million among larger states in India, where according to a Times of India report, on a 7-day average, Kerala is testing 4,587 people per million, and for every 1 lakh, it is testing 78,336 people. But the biggest factor on why Kerala is still reporting a high number of cases is because a large chunk of its population does not have any antibodies against the virus. According to the seroprevalence survey, only 44% of the population above the age of 6 years has been infected by COVID, compared to the national average of over 67%. In an earlier interview with the Quint, Dr. Gautam Menon, a professor of physics and biology at Ashoka University, stated that the reluctance of cases coming down in Kerala shows that a sizable percentage of the population has not been infected by the virus.
So Kerala is a mystery. And I mean, my own feeling is that Kerala was actually somewhat more successful than other states in terms of controlling its case numbers and in terms of controlling its infections. It shut down fairly stringently and it sort of unlocked down also with fairly rigorously. And if you look at the sero surveys conducted in Kerala, which found about 10% of people had prior infection by early January, by about the 10th of January, compared to numbers like 20% plus across all of India on average, and much larger than that in the individual cities, in the major cities of India. So that suggests to me that overall, fewer people on average are infected in Kerala, the fraction of the population compared to the rest of the country, that the intervention that the Kerala government did were somewhat successful in keeping these numbers down. But on the other hand, there are more people to be infected. And that's a negative of this, that there are more people potentially who could be infected. And I think that's what you're seeing in this reluctance of the number to come down. It's just that people are now slowly getting infected. There is a background of infection. But importantly, those numbers are not large enough to cause a serious strain on the health system. And that's what we should be looking at.
According to the Kerala government dashboard, the total active cases in Kerala at the moment are 1,67,381, and 5 out of the 14 districts in Kerala contribute nearly 1 lakh of active cases in the state at present. However, even though the state is seeing a high caseload, it has reported a low mortality rate. According to COVID-19India.org, Kerala has reported a 0.5% mortality rate compared to the national average of 1.32%. We spoke with Dr. Sulfi Nuhu, Secretary of the Kerala chapter of the Indian Medical Association, and according to him, hospitals are currently only 50% full, and the cases at present are manageable. He sheds light on how hospitals in Kerala are managing the current caseload.
At the moment, the hospitals are not, it's not touched yet. I think we can have, we are almost 50% full, maybe 60%, up to 60% as far as ICU, intensive care units, beds, ICU beds, oxygen beds, and other facilities are concerned. But in some districts, one or two districts, it's going up. The total number of admissions are going up. And also, if you take up the total picture for the last few days, the hospital admissions are also gradually ticking up. That is an issue. But overall, the hospitals are not full. It's not, it is still manageable, even though we have some deaths every day, but still manageable. The last lockdown, it was almost full. We were in the verge of a collapse. So I think we are anticipating a spike of number of admissions in the hospitals and especially in intensive care units a week before the total shutdown. So we need to shut down even before it reaches the full. The hospitals become full. Regarding the number of tests, the total number of cases are up. We have to understand this basically. The total number of cases are more. We have around 20,000 cases per day. But we have to understand this. We've been doing almost 2 lakhs, 1.7, 1.3, 1.8 lakh tests per day. So that's why it's a planned move to test more, to identify more, and we are doing targeted testing. So that's why we get more cases. We are not worried about the total number of cases. We are worried about the TPR and few pockets, in fact. we were anticipating this rise, 20,000 plus. If you do more tests, that is naturally. So even when we did 1 lakh test when it was 40,000 cases, 40,000 cases last month, maybe in June, the total test done was around 1 lakh only.
Mm-hmm.
Now we are doing 2 lakhs plus, almost 2 lakhs, and we get around 20,000.
Mm-hmm. Are the cases that you're witnessing right now severe cases of COVID? Are they just mild cases?
Yeah, we are witnessing only mild cases, luckily. Majority, a good number of them. But that's why the hospital admissions are less at the moment. We are keeping a close watch on that, whether it is increasing or not. So, fortunately, we have some. Definitely, we have some ICU admissions, and all those things are happening. But it's comparatively, definitely lesser than the previous period.
Not only in Kerala, but the government has also stated that the pandemic is still raging in India in 7 other states. Dr. V.K. Paul, who heads the government's COVID-19 task force, on 3rd August stated that 44 districts in India have reported a high positivity rate, adding that the Delta variant second wave is not over. India on 3rd August reported 30,549 new COVID cases and 422 deaths in the past 24 hours. Though experts have predicted that the third wave will begin in August, many states are still being tormented by the second. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.